Hi, my name is Karina Vila, and I'm doing a presentation on the epidemiology and control of HIV/AIDS in Brazil. So the background of Brazil. So Brazil is the biggest country in the South American continent with a total area of 8,511,965 square kilometers. This country is separated into 5 regions, which would be the major, the north, northeast, central west, southeast, and south regions. As of 2022, the total population was 203,080,756 people, and the most occupied regions were the south central areas. Brazil is considered a stable country with a democratic government and a mixed economy, and it is considered a developing country due to social inequality, racial and ethnic disparities, as well as environmental issues within the country. When comparing to neighboring countries, the HIV count is the highest in Brazil. In 2021, the total was 960,000 people, which is remarkably higher than other countries in Latin America. Some others that had high HIV counts in that year were Colombia with 170,000, Argentina with 140,000, and Mexico with 360,000 people with HIV. The prevalence of HIV among people from 14 to 49 years old in Brazil in the year for 2021 was 0.6%. This can be seen in Figure 1, and it'll show the prevalence of HIV within all countries in Latin America. So for that year, the ranges were the lowest of 0.2%, which were in Guatemala and Honduras, all the way up to 1.8%, which is the highest percentage in Haiti. So the background of the HIV and AIDS outbreak. So HIV is a virus that attacks the human body's immune system, and when left untreated can turn into the most severe stage, which is called AIDS. In Brazil, the first case was in 1982, and it quickly turned into an outbreak. At that time, those who were primarily affected were men who have sex with men, intravenous drug users, and sex workers. During the beginning stages of this epidemic in Brazil, there was also a political shift from a dictatorship to a democratic government in Brazil, and this played a key role on the handling of this epidemic. This caused for new legislation in the 1990s, which ensured free and accessible universal healthcare treatments in Brazil, as well as there were a lot of public health campaigns, which allowed for a lot of changes to be made during that time. In 2022, the prevalence of HIV has stabilized to 0.6%, which is a drastic decrease compared to the start of the HIV/AIDS outbreak in Brazil. And as of current times, the target populations are now men who have sex with men, intravenous drug users, sex workers, adolescents, and prisoners. So Brazil has implemented several methods of surveillance. The main surveillance method was the Unified Health System in Brazil, which was established in 1990 at the same time that they established universal and free healthcare for all Brazilian residents. This nationwide infrastructure was created for data collection, monitoring, and reporting of diseases, especially of HIV during the time of the beginning of the outbreak. They also implemented widespread testing, early diagnosis, and follow-up for HIV. Brazil has also collaborated with other international organizations as well in order to help with the surveillance of HIV. Some organizations would be the Joint United Nations Program on HIV and AIDS, the Pan American Health Organization, the World Health Organization, and other national institutions. With the surveillance, there are differences between the rural areas of Brazil and the urban areas. In rural areas, they rely on primary healthcare facilities and public health organizations for testing, treatment, and surveillance of HIV and AIDS. And this does cause cases to be underreported sometimes due to the lack of electronic records, and there is less accessibility to healthcare services in poor and rural areas. Urban areas, however, use electronic health records and mandatory AIDS case reporting to gather statistical data, analyze trends, and determine effectiveness of treatments of AIDS. And the surveillance of the populations of interest and the research focused mainly on our current target populations will be men who have sex with men, transgenders, sex workers, intravenous drug users, adolescents, and prisoners. So for the epidemiology of HIV and AIDS in Brazil, currently it is considered a concentrated epidemic due to the fact that the HIV prevalence has been consistently under 1% for several years and only primarily affects the previously mentioned targeted populations. Some predominant risk factors are unprotected sexual behaviors, intravenous drug use, lack of education, lack of accessibility to healthcare or HIV treatment, low socioeconomic status, and cultural taboos. Some modes of transmission for HIV are exchange of bodily fluids such as blood, semen, vaginal fluids, and breast milk. And then the vulnerable populations in Brazil are, once again, men who have sex with men, sex workers, transgender women specifically, adolescents, intravenous drug users, and prisoners. For the demographics and burden of HIV and AIDS in Brazil, in 2022, the prevalence rate of HIV for people in Brazil aged 15 to 49 years was 0.6%. However, when looking at Table 1, which will be seen in the next slide, when the data was adjusted for gender, males were shown to have a slightly higher prevalence rate in comparison to females, which is 0.8 versus 0.4% respectively. The transgender population in Brazil have an estimated HIV prevalence rate of 30%. Men who have sex with men have a rate of 18.35%, intravenous drug users with a rate of 5.9%, and prisoners with a rate of 4.5%. The burden of this disease in Brazil posed significant challenges relating to public health and the stability of the country due to its high incidence and mortality rates. As of 2022, the total count are 990,000 people in Brazil are living with HIV, and 51,000 of them are considered new cases for that year. The total number of deaths from AIDS in 2022 were 13,000 people. And northern regions in Brazil are disproportionately affected in comparison to the south central regions due to socioeconomic inequalities. And then in the years 2005 through 2020, which will be seen in Table 2 in the next slide, it does show that there is an overall annual decrease of 2% in HIV incident rates. However, there are differences between the regions. So there were significant declines in the southeast of 4.4% and southern regions, which is 3%. However, the northern regions actually experienced a 2.3% annual increase. And so this table will show that adolescents are most affected by AIDS, and in some regions, it will show an increasing trend. So this slide will show both tables that were previously discussed. Table 1 shows the HIV prevalence of adults in Brazil aged 14 to 49 years in the year 2021. And Table 2 shows the AIDS incident rates according to age group in Brazil and separated by regions from 2005 to 2020. So Brazil did have a lot of preventive measures implemented since the beginning of the outbreak. Some early actions were that they introduced prevention campaigns and education in the 1980s. They also implemented free universal health care via the unified health systems, and they also did nationwide distribution of condoms and safe sex education. Some initiatives that are notable in Brazil was in 1996, they were the first country to provide free, highly active antiretroviral therapy to all its residents. There is also nationwide free HIV testing services. And in 2014, they did create a test and treat initiative, which facilitated the early HIV testing and immediate treatment. A 2019 study showed the 62% decrease in AIDS detection rate and 79% reduction in mortality after implementing this initiative. Now, current campaigns focus on high-risk populations with effective education campaigns, and it specifically targets the high-risk groups, which were men who have sex with men, sex workers, and transgender individuals. They have also recently implemented the distribution of pre-exposure prophylaxis medication across 35 sites in the country. Some barriers that are faced in Brazil on HIV and AIDS control, there are socioeconomic issues, which is the economic imbalance between the South, Central, and Southeast regions and the Northern regions, since the South and Southeast regions in Brazil have higher socioeconomic statuses. This causes a difference in the quality of education and healthcare access throughout each region, and overall negatively impacts poorer regions as they have less access to health education and services. There also is issues with healthcare accessibility. So despite that there's free healthcare, a 2019 survey showed that 3.8% reported unmet needs for services and 7.5% for medications. There's also long wait times for medical attention as the healthcare is free there, and you can get supplemental private health insurances. However, it is costly, and they will receive faster and higher quality of care, which is not feasible among those who are poor and can't afford those private insurances. There's also issues as there's a limited supply of essential free medications, and this leads to many cases being missed or diagnosed at later stages or delayed in treatment. There are also societal issues such as the stigma and discrimination against these high-risk populations for HIV. Targeted groups will sometimes avoid testing or treatment due to fear of ostracization, and there are continued unsafe practices and misconceptions about HIV and AIDS in certain areas. So, assessing the effectiveness in Brazil, it is overall successful in controlling HIV and AIDS through effective public health initiatives and surveillance strategies. Brazil has been a pioneer in implementing public health initiatives and surveillance strategies to manage these cases. They have managed to drastically decrease the AIDS-related mortality rates, decrease in cases of HIV, and provide adequate treatment to those infected. They also implemented free universal health care. They implemented the test and treat initiative. They have continued to promote health education and provide campaigns, as well as nationwide distribution of condoms and other medications for HIV. The continued work of numerous organizations and ongoing studies aimed at the supporting high-risk regions and populations do signify that Brazil is continuing to work on decreasing the amount of cases per year and it shows that they have implemented a comprehensive approach to addressing HIV. So my proposal of a prevention and control strategy for HIV is just to focus on the impoverished areas and regions with high concentrations of the high-risk populations, as those are the ones that are most affected in current times. Um, I would suggest doing mobile clinics, so community-based organizations to provide accessible healthcare services such as HIV testing, physician consultations, and treatment through these clinics. And these clinics will rotate through the high need locations multiple times a year to ensure ample opportunities for testing and treatment for these areas. As well as health education is a very important aspect. So in-person educational sessions will be conducted by volunteers to destigmatize HIV and AIDS and raise awareness about the importance of testing and treatment. And sessions will be held in culturally safe and easily accessible locations such as community centers, churches, schools, and public libraries, just to create a safe space for these individuals. And here are my references. Thank you so much.